Well, I'm not sure we're going to be able to declare it over. I think we're going to have a very quiet summer with respect to coronavirus spread and then have to contend with it again as we head into the winter. Right now, we're at about 8 cases per 100,000 people per day. If you look at the CDC's website, they define low transmission at around 1 case per 100,000 people per day. We're dropping by about a point every 2 or 3 days. So my guess is by next week, we'll be at around 5 cases. By the end of next week, around 5 cases per 100,000 people per day. And as we get into June, we might approach that one level. Cases have sort of plateaued in California at around 3 cases per 100,000. In Israel, they continue to come down. So I'm hopeful they're going to continue to come down here, and we're going to have very little coronavirus transmission as we get into the summer. Certainly by June, I think we're going to see that.
A significant portion of the U.S. population, though, Dr. Gottlieb, is not vaccinated and will not get vaccinated. That's a fact. And yet you're citing some numbers showing that the overall U.S. cases continue to come down. Does that imply that we've reached some sort of herd immunity or are close?
Well, we might be approaching it. We've now vaccinated close to 50% of the public that has at least 1 dose. And remember, a lot of people have been infected. At least a third of the population have been infected. And my guess would be, and we don't have data on this, but my guess would be that the infection level among the unvaccinated population is probably higher because a lot of people probably aren't getting the vaccine because they knew they were previously infected. And probably people who are willing to forego the vaccine might be people who are out and about a little bit more and are just a little bit more cavalier about the virus, a little less concerned about it, maybe because they're young and at less risk. So if you assume that the percent of prior infection among the unvaccinated population is more than that third, and it probably is, and you assume that we've given at least 1 dose to around half the population right now, we're approaching pretty high levels of immunity, and that's certainly contributing to the decline in infection. Also contributing to it is just the seasonality. We're getting into the warmer months. And people are being more cautious generally, even though we're starting to take masks off and go out and about. People are more cautious about their interactions. So some of that is still having a downward effect on transmission.
Should we be opening up international travel more than we have?
Well, I think certainly with Europe. I think Europe's going to probably experience a similar trajectory to what the United States is experiencing right now. They're a little further behind on their vaccination. But if you remember last summer, Europe had very low transmission levels as people migrated out of their cities into the countryside. They're likely to experience that again, and they will be ramping up their vaccinations as they get into the summer. So I think it's going to be safe to travel to Europe. Other parts of the world are a little bit more suspect. I think you can certainly travel to Asia, but it's going to be hard to travel to Asia because a lot of the Asian countries are putting in place restrictions that make travel pretty hard. So, other parts of the world, certainly South America, India right now, you're seeing parts of Asia like Thailand, infection levels starting to rise. So there's parts of the world that look more suspect than Europe or the United States right now.
Prediction, Dr. Gottlieb, do you think we will ever have in this country another surge in cases tied to a variant that is resistant to a vaccine?
It's hard to tell. So far, every variant that we've seen, the mutations that we've seen, the vaccines, the mRNA vaccines seem to cover it pretty well. And so far, the experimental evidence on 617, the Indian variant, also suggests that the mRNA vaccines cover that variant as well. Could these mutations combine in a new strain in a way that obviates some of the vaccines or reduces their efficacy more than what we've seen? Perhaps. But so far, across all the mutations that we've seen, the vaccines seem to be still effective. Sometimes the vaccine efficacy declines to the 70% and 75% range based on some of the estimates, but that's still pretty effective, and that's still effective enough that if we have a high proportion of the population vaccinated, it's going to be a backstop against those variants really getting a foothold in the population.
What do you think, Dr. Gottlieb, about these ideas of global vaccine passports? Are they likely? Are they very hard, really, to establish? And should they be pursued if possible?
Look, I think they're hard to establish, but I think we're going to see them in the travel sector. Right now in the United States, the impediment is that many people can't get access to their vaccine status in a digitally verifiable way. That data is owned by these jurisdictions, these state jurisdictions, and not every state makes their websites accessible to consumers or to a third-party app where consumers might want to pull it into, say, Apple Health Vault. So we need someone to go around state by state and negotiate with the states mechanisms that allow people to pull this information into apps so they can actually own it. So if they want to use it, they can. You don't have to use it, but if you want to use it, and if you're going to need to demonstrate vaccination status for certain kinds of settings, you should want to get access to that information. I think there might be domestic uses for that information as well. There might be circumstances next winter when the virus flares again where, for example, nursing homes might restrict visitors unless you've been previously vaccinated, or hospitals might restrict visitors unless you could demonstrate that you've been vaccinated. So people are going to want a way to demonstrate digitally in a verifiable way beyond just these cards that they've been vaccinated. I think it's going to be important.
Shepard Smith here. Thanks for watching CNBC on YouTube.